when should we suggest OGTT, or what kind of people we should suggest OGTT tests? So for the patients whose fasting blood glucose levels fall between 100 to 126 milligram per deciliter, that means they are inconclusive fasting results. They have to undergo OGTT test. Then the pregnant women where there is excessive weight gain or there are any miscarriages, those people have to undergo OGTT test. And to rule out any other conditions like benign renal glucosuria, these people also have to undergo OGTT test. But why is this OGTT test being done? Because sometimes the traditional test can miss the diagnosis. But out of those cases, 30% can be detected still by OGTT. Hence, that is one of the uniqueness. Then it identifies the impaired glucose tolerance patients. And finally, it can be used as a screening test in asymptomatic patients. So these three things, that is why that makes the OGTT a unique test. So 30% of the misdiagnosis can be detected by the OGTT. Impaired glucose tolerant patients can be detected, and asymptomatic patients can also be screened. When we just saw about who should be undergoing the OGTT test, now we will be seeing who shouldn't. So the patients who are already diagnosed as diabetes, they need not be going for OGTT test. Then OGTT is for initial diagnosis, but not for the follow-up phase. And the patients who are already sick and having some other conditions at the moment of test, they need not be going to OGTT test. That means acutely ill. Some chronic conditions might be present, but the patients who are acutely ill, they should not undergo the OGTT.